Welcome, everyone. I think we're ready to start this afternoon's session. My name is Russ Pate, and on behalf of the National Physical Activity Plan Alliance, I'm very pleased to welcome you to this webinar on the very recently released second edition of the Physical Activity Guidelines for Americans. The National Physical Activity Plan Alliance is delighted to be collaborating today with the American Heart Association and hosting this webinar. For those of you not familiar with the National Physical Activity Plan, I'll mention just briefly that, that the National Plan is a comprehensive set of strategies that are aimed at increasing physical activity in all segments of the U.S. population. The current plan was released in 2016. It includes over 50 strategies and over 250 tactics organized around 9 societal sectors. For more information on the national plan, please check the website, which is at physicalactivityplan.org. Today, of course, our focus is on the second edition of the Physical Activity Guidelines for Americans, which was released just yesterday during the American Heart Association scientific sessions in Chicago. Very pleased to have with us today and to be able to introduce Katrina Piercy of the Office of Disease Prevention and Health Promotion in the U.S. Department of Health and Human Services. Dr. Piercy led the effort to develop the guidelines. She coordinated the work of the Physical Activity Guidelines Advisory Committee, the report of which informed the Physical Activity Guidelines, and she led the effort within the Department of Health and Human Services to develop the actual guidelines, which were released yesterday. And I'm delighted to turn this over to Dr. Piercy. All yours.
All right, thank you, Russ, for the introduction. This is Katrina Piercy, and I'm pleased to be a part of this webinar today to give you all an overview of the Physical Activity Guidelines for Americans second edition. I want to thank the National Physical Activity Plan Alliance for hosting today's webinar, and also Dr. Russ Pate for his work as part of the advisory committee and the lead for the subcommittee, the youth subcommittee. We were pleased to release the guidelines yesterday at the American Heart Association scientific sessions. And so you all are getting kind of one of the first glimpses of what's in the guidelines. The plan for today is to go over a background and development of the guidelines, to next discuss what's new, because I'm sure that's what everyone is interested in, highlight the key guidelines for various population groups, and then talk about our Move Your Way communications campaign. We will have time at the end for questions, and I've also seen some questions coming through in the live chat, and we will address those as well. So first, a little bit of a historical background about the development of the guidelines. So the Physical Activity Guidelines for Americans was first issued in 2008. It was the first comprehensive guidance on physical activity from the federal government, based on an extensive systematic review conducted by a federal advisory committee, the Physical Activity Guidelines Advisory Committee, and provides science-based advice on how physical activity can help promote health and reduce the risk of chronic disease in those ages 6 and older. This is for the 2008 guidelines. 5 years after the release of the first edition, HHS released the PAG mid-course report, which focused on how to get youth more active and meeting the guidelines of at least 60 minutes a day at school, preschool and childcare, community, family and home, and in primary healthcare settings. And now, 5 years after the mid-course report, we've released the second edition of the Physical Activity Guidelines for Americans. This new edition provides recommendations on how physical activity can help promote health and reduce the risk of chronic disease in those ages 3 and older. Now a little bit about how we developed the guidelines. This is a multi-year effort with a large number of people involved across the department, as well as the outside Federal Advisory Committee group. So this will walk you through the process, which begins with a review of the science by an independent external advisory committee. And this group was appointed back in June of 2016, and they were tasked to complete an extensive systematic literature review on physical activity and health. The committee's systematic review was compiled into a scientific report and submitted to the HHS Secretary last February of 2018. If you're interested in reading it, it's up on our website, health.club/PA guidelines. It's quite extensive, close to 800 pages, but a really detailed and well thought out report of the state of the science and where we are now. The department, that is HHS, used the committee's report, public comments, and agency comments to then update the physical activity guidelines. And after its release, so starting now, the information in the guidelines will be incorporated into federal initiatives and resources, like the Presidential Youth Fitness Program and public health objectives in healthy people. I want to take a moment and thank and acknowledge the work of our 2018 Physical Activity Guidelines Advisory Committee. These 17 experts devoted a significant amount of time volunteering to help ensure that the policy was grounded in the strongest scientific evidence. So a little bit about the role of the advisory committee. As I mentioned, they were officially appointed in June of 2016, and they were tasked to update information that was done from the previous committee in 2008, identify new areas of research, and give us an update on the current evidence of physical activity and health. What they did is divide themselves into 9 subcommittees covering a variety of different topic areas, things like populations such as older adults, individuals with chronic conditions and youth, as well as health outcomes like brain health, cancer, and cardiometabolic health. Other subcommittees dealt with physical activity and sedentary behaviors, and the promotion of physical activity, a new area for this year. The committee was governed under the Federal Advisory Committee Act and held a series of public meetings to provide updates on its literature review between July of 2016 and October of 2017. During that time, they addressed 38 main questions and 104 sub-questions. So it was a huge volume of literature that this committee went through. And then in February of 2018, they submitted their scientific advisory report to the Secretary of Health and Human Services. From there, we took their advisory committee report as the foundation for the guidelines, also incorporated public comments on their report, federal agency comments, as well as a peer review process after we had done an initial draft of the physical activity guidelines. So there were several layers of review and process to put these guidelines together. And then from there, as I mentioned previously, the guidelines will then inform physical activity programs, research, and initiatives across the federal government and at the state and local level, and hopefully through many of the programs that you all work with. So what's new? Let's dive into what we have coming through in the new guidelines. So in the past 10 years, the evidence base for physical activity and health has grown tremendously. The second edition of the Physical Activity Guidelines for Americans is based on the latest scientific evidence about physical activity and health and builds on the first edition that was published in 2008. On the next few slides, I'll walk through each of the new pieces of the guidelines that are shown on this slide, and then we'll discuss the key guidelines for each population group. So starting out with new key guidelines for children ages 3 through 5. As you recall, the 2008 guidelines started at age 6. Due to new evidence, we were able to make recommendations for this younger population. Children and adolescents usually do not develop chronic diseases such as heart disease, hypertension, type 2 diabetes, or osteoporosis. However, current evidence shows that obesity and other risk factors for these diseases are increasingly appearing in children and adolescents. For children ages 3 to 5, we know that physical activity improves bone health and weight status. Regular physical activity also makes it less likely that these risk factors will develop, and more likely that children will remain healthy when they become adults. Because we now know that there are health benefits specifically for children ages 3 to 5, we can issue guidance for this age group. Preschool-age children should be encouraged to move and engage in active play, as well as structured activities such as throwing games and bicycle or tricycle riding. To strengthen bones, young children to do activities that involve hopping, skipping, jumping, and tumbling. Although the specific amount of activity needed to improve bone health and avoid excess fat in young children is not well defined, a reasonable target may be 3 hours per day of activity of all intensities, light, moderate, or vigorous intensity. This is the average amount of activity observed among young children of this age and consistent with guidelines from Canada, the United Kingdom, and the Commonwealth of Australia. The first key guideline for adults is to move more and sit less. This is based on the increased evidence that we now have looking at the relationship of sedentary behavior and health. As you can see on this slide here, sedentary behavior increases the risk of all-cause mortality, cardiovascular disease mortality, cardiovascular disease, type 2 diabetes, colon, endometrial, and lung cancer. All physical activity, especially moderate to vigorous activity, can help offset these risks. For inactive adults, replacing sedentary behavior with light-intensity physical activity is likely to produce some health benefits. Among all adults, replacing sedentary behavior with moderate or vigorous intensity physical activity may produce even greater benefits. The figure shown in this slide here is from a meta-analysis of over 1 million people by Eklund and colleagues, demonstrates the relationship between moderate to vigorous physical activity and the risk of all-cause mortality. At the greatest time spent sitting, so this is the upper corner up here, the risk of all-cause mortality begins to decrease as you see the color changing to orange, even with small additions of moderate to vigorous physical activity. At the greatest volume of moderate to vigorous physical activity, the risk is low even for those who sit the most. So this is referring to the upper right-hand corner where you see the green. At the lowest volume of moderate to vigorous physical activity, which is the far left corner, the risk of all-cause mortality increases as time spent sitting increases as well. This suggests that for inactive adults, replacing sitting time with light-intensity physical activity reduces the risk of all-cause mortality. But even bigger benefits are seen by replacing sedentary behavior with moderate or vigorous physical activity. So the bottom line here with sedentary behavior, we don't have a specific number or recommendation of how much time you should spend sitting or not sitting during a day. But this graph gives us a nice illustration of how to balance out the sedentary behavior. So even if you do have a sedentary job or commuting for a while, you can balance that out by doing moderate to vigorous physical activity. So next is the removal of the bout requirements, and this comes across in the message that any activity counts. So in 2008, we had a recommendation that a minimum of 10 minutes of activity needed to be done to count towards meeting the guidelines for adults. We now know that any amount of physical activity has some health benefits. Americans can benefit from small amounts of moderate to vigorous physical activity throughout the day, like taking the stairs and doing chores around the house. Many of the benefits of physical activity are immediate. For example, physical activity can reduce anxiety and blood pressure and improve quality of sleep and insulin sensitivity the same day of doing a bout of activity. This figure here demonstrates that even the benefits of even low amounts of moderate to vigorous physical activity. So as you see at the beginning of the graph, there is a steep early slope here. And this is a quick drop off indicating that the benefits are most significant of someone who is not doing any physical activity to starting some physical activity. The relative risk of all-cause mortality continues to decline as people become even more physically active. And then ideally, we're getting people into this range here, which is in the, where you can see at the bottom of the graph shows 150 to 300 minutes of moderate physical activity, which is the target range of physical activity guidelines for adults. The other thing that is important to note on this slide is that there's not evidence of increased risk, even at the high end. So even individuals doing 3 or even 5 times the recommended amount in the guidelines, there's not an increased risk here. So the bottom line is any activity counts. So small things throughout the day, parking a little farther away, walking down the hall instead of sending the email can help add up to the 150 minutes recommended for adults. So new health benefits. So a lot of what we were able to do for this next edition was to confirm the information in the 2008 guidelines, but we also came away with a lot of new information and a lot of new health benefits. As I mentioned on the previous slide, several of these were acute benefits, things like blood pressure and insulin sensitivity. There's also a number of them that are more long-term benefits. For example, with youth, physical activity can improve cognition, bone health, fitness, and heart health, I should note that on the slide here, it's highlighting some of the new pieces, but I'm going to talk through in general some of the benefits. For adults, physical activity helps prevent 8 types of cancer: bladder, breast, colon, endometrium, esophagus, kidney, stomach, and lung. We only knew about 2 types of cancer in 2008. It reduces the risk of dementia, including Alzheimer's disease, all-cause mortality, heart disease, stroke, blood pressure, type 2 diabetes, and depression. It also improves bone health, physical function, and quality of life. For older adults, physical activity also lowers the risk of falls and injuries from falls. And for pregnant women, physical activity reduces the risk of postpartum depression. For all age groups, physical activity reduces the risk of excessive weight gain and helps people maintain a healthy body weight. We know that over 50% of Americans have one or more chronic diseases. New evidence also shows that physical activity can help manage more health conditions that Americans already have. For example, physical activity can decrease pain for those with osteoarthritis, reduce disease progression for hypertension and type 2 diabetes, reduce symptoms of anxiety and depression, and improve cognition for those with dementia, multiple sclerosis, ADHD, and Parkinson's disease. So as you can see here, we've almost touched on just about all of the various chronic conditions or health conditions seen with the benefit of physical activity. So to dive a little deeper into one of the areas, a newer area that the committee was looking at would be brain health. This is where we're seeing both acute and chronic benefits. Regular physical activity improves aspects of cognition throughout the lifespan. And as the slide shows here, there's a variety of different populations that have been studied, from children to adults to older adults. For kids, for example, we're seeing benefits with improved cognition, specifically related to academic performance. With adults, reduced risk of dementia, as I mentioned before, and improved cognition in older adults as well. In addition, for adults, we're seeing improved quality of life by doing regular physical activity. And to talk a little bit more about brain health, anxiety and anxiety disorders are the most prevalent mental disorders. Short-term feelings of anxiety are reduced immediately following a bout of moderate to vigorous physical activity, and regular physical activity has positive effects on long-term feelings of anxiety as well. Habitual physical activity also reduces symptoms of anxiety and depression in adults and can reduce the risk of even developing depression. And good news for all of us, physical activity can help us sleep better. Now, it doesn't matter the number of hours before bedtime that you're doing physical activity. So if you're a morning person, great. If you're an evening person, that works too. The benefits for physical activity are similar for activity that's performed more than 8 hours before bedtime, 3 to 8 hours before, and less than 3 hours before bedtime. So what works? One of the new pieces that was added for the 2018 advisory committee was a subcommittee that looked at physical activity promotion and what worked to increase physical activity levels. So they divided the evidence into what works for individuals or small groups, as well as what works for communities. And I'll talk a little bit later about some of the sector-based approaches as well. So for individuals, guidance from peers or professionals can help provide support or encouragement to get started or to continue being physically active. And this can come from things that are online or in person or via text, a number of different modalities, but having peers or professionals or a buddy really does make a difference. Technology, such as wearable devices or trackers, can help to log physical activity and provide reminders to get moving. This also helps with things like removing that 10-minute bout. So all of those little steps, if you're wearing a tracker, you can be able to see how your steps are accumulating throughout the day, for example. And at the community level, we know things like signage to suggest taking the stairs or how far away a location can be, urging you to take a walk there instead of maybe getting on a cab, can help suggest or encourage people to do some more physical activity. School policies can make a big difference, both during and outside of the school day. Access to recreation facilities are also very important at the community level. We also know the community campaigns, something we at ODPHP will be starting in 2019 to pilot test in 2 communities, works well as changes to the built environment, things like sidewalks, adequate lighting, bike paths. So before I get into the key guidelines, I want to pause and describe the levels of intensity, because you'll see these terms throughout the key guidelines. Intensity can be described using an absolute scale using METs, or in a relative scale, meaning it's relative to a person's individual capacity. We often use the talk test to distinguish between the two, moderate and vigorous. With moderate intensity, your heart is beating faster and you can talk but not sing. A person doing vigorous intensity activity cannot say more than a few words without pausing for a breath. There are many activities that may be considered either moderate or vigorous. Something like biking or swimming can be an example. It just depends on the intensity to which someone is doing it. And a lot of times it may be easier to look at a personal, someone's individual, how they are feeling to get a sense of the intensity level versus using the absolute scale, especially with an older population and especially with kids. So let's talk about the key guidelines. We break the main messages of the guidelines down by populations. So we have key guidelines for children and adolescents, healthy adults and older adults, women during pregnancy and the postpartum period, and individuals with disabilities and chronic medical conditions. There are also key guidelines for safe physical activity for all age groups. I already discussed the key guidelines for preschool age children, so I'll dive right into children and adolescents. So as you can see here, the key guidelines for children and adolescents ages 6 to 17 is unchanged from 2008. Youth need 60 minutes or more a day of moderate to vigorous physical activity. They need to do activities that are muscle strengthening and bone strengthening on at least 3 days a week, as well as including vigorous intensity physical activity. Children and adolescents usually don't develop chronic diseases such as heart disease, hypertension, type 2 diabetes, or osteoporosis. However, current evidence shows that obesity and other risk factors for these diseases are increasingly appearing in children and adolescents. That's why it's important to start these behaviors young in this population, as well as even younger with the preschool age children as well. Key guidelines for adults. I've already mentioned before the first piece of the key guidelines. Adults should move more and sit less throughout the day. Some physical activity is better than none. Adults who sit less and do any amount of moderate to vigorous physical activity gain some health benefits. The quantitative key guidelines for adults are unchanged from 2008. So adults need at least 150 to 300 minutes of moderate intensity, or 75 to 150 minutes of vigorous intensity, or a combination of two. Note there is a range. 150 minutes is the bottom limit of the range, but even more benefits are seen by moving toward and beyond 300 minutes a week. Similar to 2008, 1 minute of vigorous intensity is equivalent to 150 minutes of moderate intensity. Adults also need 2 or more days a week of muscle strengthening physical activity. And for older adults, they have the same key guidelines as adults, but then with these additional 4 messages. So one change for older adults is the recommendation to do multi-component physical activity. This includes balance training, aerobic, and muscle strengthening activities. The benefits for these are with improving potential injury from falls and the extent of the injury for that. So adding in the multi-component can really help make a difference in the older adult population. Ideally, older adults should work to meet the key guidelines that were discussed in the previous slide, but they may need to make some modifications depending on what's happening with any of their chronic conditions. And that's what the rest of these bullets highlight, that there may be some modifications in this population. So let's talk about adults with chronic health conditions or disabilities. So there's a number of benefits to being regular physical activity for most individuals. Ideally, we'd like everyone striving to meet the key guidelines. However, realizing that there may be modifications that need to be made. So as you see, the first bullet here is the exact same message as the adult key guideline, as well as the second one talking about the muscle strengthening benefits. However, with the caveat that individuals with a chronic condition should be under the care of a healthcare provider. They may need to make some modifications depending on their current symptoms or current conditions to adjust their physical activity levels. But in general, we'd like everyone to be striving to meet the guidelines. And there's benefits for a number of these population groups that are discussed more in the guidelines. Key guidelines for women during pregnancy and the postpartum period. Again, similar information from 2008, encouraging women to do regular physical activity of at least 150 minutes of moderate intensity aerobic activity a week. Ideally, this is spread throughout the week. That's a point I hadn't mentioned previously, but for all of these guidelines, ideally it's spread throughout the week. If you only have the time to do it on the weekend and weekend warrior, there are still benefits to meeting all of the guidelines in a few days time period, but the benefits are a little bit better if it's spread across the week. Women who are physically active and engaging in activity of any intensity, up to vigorous intensity, prior to becoming pregnant, can continue these activities for the most part safely during pregnancy. However, they should be under the care of a healthcare provider to monitor the progress of the pregnancy, and therefore a provider can help make adjustments if they're needed to a woman's physical activity routine while she's pregnant. And finally, key guidelines for safe physical activity. This is for all populations. Yes, there are some risks to physical activity, but by following these key guidelines, there are things that you can do to minimize your risk. The first thing to do is to choose activities based on your level of fitness. Healthy adults generally don't need to see a provider prior to starting physical activity. However, they can decrease their risk of injury by starting low and going slow. And as noted in the last bullet, individuals with chronic conditions or symptoms should be under the care of a provider to manage their conditions. I mentioned that on an earlier slide. It's also important to use appropriate gear and safety equipment and to be mindful of the environments you're working out in. So let's shift gears a bit and talk about promoting physical activity. So with so many health benefits, we need to ask ourselves, why is it so hard to get people moving? Numerous factors influence physical activity behavior. Although some benefits of physical activity begin immediately, benefits related to disease risk require regular physical activity over time, and thus the benefits may not be immediately evident. In addition, making physical activity a habit requires individuals to overcome personal barriers such as lack of time, fatigue, and disability, and to find ways to make physical activity routine a part of the day despite other responsibilities. Friends, families, and peers can significantly influence this lifestyle choice, as do environmental factors such as climate, weather, personal safety, and access to parks, sidewalks, playgrounds, and organized sports. So why do we need to do this? In the United States, nearly $117 billion in annual healthcare costs and 10% of all premature mortality stem from failure to meet levels of physical activity in the guidelines. So this is both the aerobic and the muscle strengthening component. In fact, only 26% of men, as you can see on this graph here, and 19% of women meet the guidelines, despite that these are readily achievable by most Americans. By simply meeting the physical activity guidelines, billions of dollars and hundreds of thousands of lives could be saved, and millions more Americans could experience improved quality of life. As shown in the figure, there's been some progress in increasing the activity level of adults. In fact, the Healthy People 2020 target for this objective has been exceeded. But as you can also see, there's tremendous room for improvement. So shifting to children, we have the same picture where we have tremendous opportunity to increase physical activity levels. For kids, only about 20% of adolescents report sufficient activity to meet the aerobic and muscle strengthening guidelines. Data from this slide is from the Youth Risk Behavior Surveillance System. And unfortunately, it's showing us that we're starting to have a little bit of a decline, not a rise. Physical activity fosters normal growth and development. Further efforts to increase the activity level of youth are critical, as childhood obesity rates have more than tripled since the 1970s. Lack of physical activity is also a threat to our national security, because obesity disqualifies nearly 1/3 of American youth ages 17 to 24 years from military service. So what can we do? Pulling out some information from the last chapter in the guidelines and from work of the promotion subcommittee, there's several things at the individual level and at the family and caregiver can do. Starting at the individual level for yourself, things like personalizing the benefits of physical activity. I've laid out a number of different reasons from the health side to the feel-good side of things of why you should be doing regular physical activity. But many people need a why that's personal to themselves. So figure out what motivates you. Set personal goals for physical activity and develop knowledge and skills to attain goals. So that means figuring out what skills you might need to do if you wanted to start a new activity, or you wanted to start playing tennis. You may need to take a lesson or figure out how to swim. But those are different things to be comfortable doing a different type of physical activity. And for most people, walking is one of the simplest and easiest ways to get started. And for families and caregivers, First bullet here is to start early. So this addresses with the young kids. Starting it out young and making it a part of a young child's routine can help set up that behavior, hopefully for a lifetime. Providing time for both structured and unstructured physical activity during school and outside of school. Providing youth with positive feedback and good role models. Helping young people learn skills required to do physical activity safely, and promote activities that set the basis for a lifetime of activity. So then shifting into what can be done at the sector level. If these sectors look familiar to you, these are the same pieces from the National Physical Activity Plan, which talks about the different ways that various parts of our community can get involved and help promote physical activity. I'll talk about a few of them today. For example, for healthcare professionals, they can tailor messages about physical activity to the patient's specific health needs, connect patients to programs and events within the community, including those sponsored by faith-based organizations, and prescribe exercise to their patients through things like American College of Sports Medicine's Exercise is Medicine initiative. Those in public health, which I imagine as many of you on today's call, can support work at the community level to provide opportunities for safe physical activity. They can coordinate activities among sectors and disseminate messages about the importance of physical activity to the public. More information about the role of these sectors is in the National Physical Activity Plan, which includes objectives and strategies for each of these 9 sectors highlighted. So now to the last phase of the talk, I want to talk about our Move Your Way campaign materials, and wanted to first thank and acknowledge the work of Frances Bevington, who is our Strategic Communication Affairs Director here at ODPHP, who has led this work over the past several years. There was an extensive amount of research gone into this campaign and figuring out how best to communicate the guidelines and to ideally motivate some behavior change. So the idea behind developing this campaign was to have something similar to USDA's My Plate, which is focused on providing guidance on how to follow the dietary guidelines for Americans. So the purpose of this campaign is to raise awareness of the recommendations in the physical activity guidelines and to change behavior among consumers. The primary audience for this campaign is physical activity contemplators, or those who are not yet meeting the recommendations in the physical activity guidelines. We also designed the campaign with feedback from health professionals as conduits to this audience. On the next few slides, I'll highlight the tools and resources we created. There are over 40 available in both English and Spanish. So as you can see here, this is our series of fact sheets that are tailored for adults, older adults, parents and children, and healthcare providers. The fact sheets for adults have information on why regular physical activity is important, what kind of activity they need, and how to get it. The fact sheet for older adults explains why physical activity is key to healthy aging, what kinds of activity older adults need, and how to get it. The fact sheet for parents is helping them to understand what kind of activity kids and teens need to stay healthy and offers tips for helping kids get active. The fact sheet for kids, and this is the one on the bottom right corner, as you can see the layout's a little bit different, more focused on the youth population with specific guidance for them and tips for getting started. And then the fact sheet for healthcare providers is a great resource on how to start the conversation with the patient and clients. Often that's the best first step, is to start talking about physical activity. Next slide, you can see the images of the 5 posters we created for adults, older adults, parents, and children. The idea behind these is that they can be displayed in health professional offices, in schools, throughout the community. Ideally that this is targeting obviously a number of different audiences. So hopefully someone will find one of these posters speaking to them. The Feel Better poster for adults emphasizes that physical activity can have immediate benefits. The Dance Move poster for adults also shows people dancing and is a fun way to get physical activity. So something that's a little bit, different types of activities, different things that count and add up. Keeping Up with My Kids is a poster for parents about getting active together. One Step at a Time is a poster for older adults, shows how physical activity can help manage chronic conditions like blood pressure. And the 60-minute poster for kids shows kids fun ways they can get the recommended amounts of activity each day. And finally, we have a series of 4 videos. One big change, as I've mentioned with this edition, is the idea of getting physical activity in small increments throughout the day. So by getting rid of that 10-minute bout, We're trying to encourage people to get started and to do something. And so a lot of these videos are focusing on kind of these life hacks and ways to fit it into your day. So there's a tips for getting motivated, tips for busy days, tips for getting active as a family, and tips for getting active and out indoors. So if the weather's not great, these are things that you can do with just what you've got at home. And then finally, we have two interactive tools. The Move Your Way Activity Planner, which helps adults build a personalized physical activity plan and offers tips for putting into your daily routine. And the Move Your Way Parent Infographic, interactive graphic, helps parents figure out if their kids are getting up to the 60 minutes a day recommended, and to think of other ideas on that, how to add in more activity. I want to give you all a quick demo of the Move Your Way Activity Planner, just so you can see how that piece works. All right, so this is our Move Your Way Activity Planner. As you can see here, this is on health.gov/moveyourway/activity planner. So you can get to that from our main website, health.gov/PA guidelines, as well as health.gov/moveyourway. So the idea behind this is to help somebody kind of plan out their week ahead. There's no login, so you just go ahead and get started. You can either click on to just show aerobic activities or just show muscle strengthening. We're going to leave both of them up because I'm going to build out a week. So let's think about what somebody may want to do during a week. Brisk walking is a great way to get started. So you pick how many minutes you're going to do. Let's aim for 20 minutes, and let's do that twice. So we're going to add that to the week. And as you can see on the far right-hand side, that it starts building towards the 150 minutes. Now, let's say we're going to do some gardening because it's fall time in the DC area, so time to do some raking and cleaning up. So that might be 40 minutes, and maybe we'll do that once on the weekend. As you see, this comes up as a muscle strengthening activity. Some gardening can count as that, as well as an aerobic activity. And lastly, it's a great time of year to go see the fall leaves. Let's go on an hour-long hike. And we are almost there. We need 10 more minutes. So this also, you could think about what's coming up next, plan ahead. So we need 10 more minutes to get in. So why don't we do some jump rope? There. And you can see that you've met the 150 minutes goals, but you still need one more day of muscle strengthening. So you can scroll through these different options. The other piece, after you go through and review your week, it'll kind of give you a map of what you are doing, and then give you some additional tips. You can print your plan, you can watch one of the short videos and get some more tips and resources. So this is a great piece that can be done with a patient or client in your office. You can do it for yourself or share with others to help give you maybe some new ideas. Things like vacuuming or doing chores around the house can be a great way to get in your minutes each week. All right, last piece for the resources is our web badges and widgets. So these are, if you go to our website, they will link directly to our tools and resources, and as we update those, they will automatically be updated. So we encourage you to use them and share them and have this information on your sites. And lastly, to find out more, there's information, as I said, our main website is health.gov/PA guidelines. From there, you can also get to all of the consumer information on the communications campaign, or you can go directly to the Move Your Way website, which is health.gov/moveyourway. So a few takeaways before we shift into questions. We know even more about the benefits of physical activity in this second edition of the guidelines. Benefits can be immediate and long-term. Everyone can benefit from moving more and sitting less throughout the day. We all have a role to play to help promote physical activity for ourselves, our families, and our communities. And finally, I'll end with an ask to help us share the information in the guidelines and to get yourself, your family, your community moving more. And now I'd like to open it up for questions, and thank you all for joining me on the webinar today.
Okay, so we have both Frances Bevington in the room to answer some questions on the Move Your Way campaign, and Katrina, who just gave our presentation. There are several hundred people on the call today, so we'll try and get through as many questions as we can. We apologize if we don't get to you. The first one is, will the slides be available for download?
So we are working on a slide deck that will go up on our website, health.gov/PA guidelines, that will have a slide deck that you can use and share if you want to teach off of that. We are working on that.
All right, then we had a couple of people ask questions about volume of physical activity. So someone asked, what is the rationale for not getting all 150 minutes in one workout versus spacing it out over the week?
So a lot of it just depends. Well, the 150 minutes came from looking at the current science, and a lot of the studies that are looking at this tend to space out physical activity over 3 or 4 times during the week. 150 minutes for a lot of people is a long time. So that would be, 2.5 hours in one segment. And some people may have time to go do a long run or a long bike ride or something like that. But for the most people aren't doing that many minutes of activity at once. But if that's all the time you have and you're able to get the guidelines in during 1 or 2 days over the weekend, then great. But a lot of the data that we're looking at, it showed it spread throughout the week.
All right. Someone else asked that it was kind of talking about how absolute and relative intensity are both being addressed in the physical activity guidelines this time. Why was it done? And does that change the target of METs for the previous guidelines?
It does not. So essentially, it's the same guidelines and the same MET level that we were talking about in 2008. We've just focused more on the intensity level to help explain it and translate it. Because outside of the exercise physiology community, the MET level explanation is a little bit more technical. But we provide both the absolute and the relative intensity as ways to determine kind of where somebody is in terms of doing moderate or vigorous intensity.
All right, I'll go to Frances for the next one. There's a couple of questions related to the Youth Focus campaign. There was a high school teacher who saw that the posters seemed to be geared towards middle schoolers. Other people are asking about preschoolers. So why was that decision made, and is there a plan to expand for older or younger youth audiences?
So we completed pretty extensive audience research ahead of building the campaign materials and decided to focus primarily on the 8 to 12 segment of the youth population, because that is specifically where we see a big drop off in physical activity, especially around year 12 for girls. We would very much like to do additional resources with segmented audiences, including additional audiences in the youth with teens, but we determined through our audience research that we really needed to do more research specifically with those audience groups before we were prepared to develop materials specifically with teens. We did do some focus groups with teens. Sorry, I just got the note that you're not hearing me very well. So just to wrap up my answer, the focus group that we did with teens and through consulting with other groups at HHS that work specifically with teens, we determined that we would really have to do customized materials that were more appropriate for teens that we were not prepared to do with the launch of the campaign. So we hope to do those in the future. But for the first launch of the campaign, we chose to focus on the 8 to 12 segment because that's where the biggest drop off in physical activity is.
Another question, how does walking count towards the 150 recommendation? Most walking is not considered moderate.
So good question. As I mentioned, walking is one of the best ways to get started and an easy way to do physical activity in terms of that you don't need special equipment. But yes, to be counting towards the guidelines, it needs to be moderate intensity. And so if you're strolling around, you're probably more on the side of light activity versus moderate. So we tend to talk about brisk walking when we think about walking to meet the guidelines. And so I would encourage you, if you're walking while you're commuting or walking and running errands, to walk a little bit more vigorously, and you will be able to get the benefits for the guidelines.
All right, a question. You mentioned that it is no longer necessary for healthy adults to seek physician guidance for physical activity. Is this different than the guidelines in 2008? If so, what went into that change?
So that is the same information that was there in 2008. What we found looking at the data is that there wasn't necessarily a change or difference in the risk of injury, but requiring that people should see healthy individuals to see a provider prior to starting physical activity added an extra barrier, which decreased people that were going to go do that physical activity. So in terms of, this is just looking mainly at injury data. Someone who has a chronic condition or symptom should be under the care of a healthcare provider to manage that, and they can help tailor things based on medications, current conditions, and symptoms, and things like that.
All right, 2 questions related to brain health. One person asked, does physical activity reduce the risk of mild cognitive impairment? And then what happens if you already have mild cognitive impairment or Alzheimer's disease if you are physically active?
So the evidence with this in brain health is a reduced risk on developing depression or, developing dementia or Alzheimer's disease. In terms of someone already having it, the committee did not look at individuals that already had mild cognitive impairment or already had dementia, but was more looking at the reduced risk in general.
All right. Someone commented that there was a specific guideline for adults with disabilities. What about youth with disabilities?
So they're mentioned a little bit in the guidelines, similar to with adults, that ideally we want to be encouraging everybody to meet the guidelines, realizing there's a range of different disabilities and abilities. It's probably best to work with a healthcare professional or physical activity specialist to help tailor things. But yes, there's tremendous benefits for everyone, for the most part, doing physical activity.
Question is for Frances. The person says that their program is interested in using the Move Your Way campaign materials. How will they go about doing that? And is there someone that they should contact? What's the plan for people who want to use the materials?
All of the materials are available for free on health.gov. They are formatted to be downloaded and printed. No permission is needed to contact HHS prior to using them. So that is the best way to access the materials at this time, is through health.gov.
And the person also asked about the particular interest in a low-income audience. Is that a group that you looked at when developing those materials?
Yes, our research for the campaign included, we specifically had quotas for individuals with lower incomes, and we wanted to make sure our samples were not biased with people who are too much in kind of middle class or high income ranges. So yes, our audience research that informed the campaign did include those populations as well.
Where can I find the graph that shows the no activity or sitting in red and then the active lifestyle in green?
It is on page 22 of the Physical Activity Guidelines for Americans. So if you download the report, you will see that graph. So that was actually a graph that the advisory committee developed based on data, as I said, from Eklund and colleagues, about 1 million participants, to develop that and put together the picture. So that figure, as well as the other ones that I had in here about the activity levels of adults and children, are also in the guidelines. As we've mentioned with the Move Your Way campaign and also with the guidelines themselves, these are federal resources, so we encourage you to use them, download them, share them, pull pieces off for other presentations, and that also goes to show with the advisory committee scientific report. So if you are, want to know more about some of these specific outcomes or where the data is, the report is a great way to find out more information and kind of dive into the science a little bit more.
All right. Someone is asking how the physical activity guidelines talk about health or about weight loss and what that relationship is.
So there was a subcommittee that specifically looked at the relationship of physical activity and body weight. One of the things that they were confirming some work from previous, that physical activity, especially combined with diet, can be beneficial for weight loss. It can also help with weight maintenance And then the new piece that the committee pulled in this time was looking at the prevention of excessive weight gain. So throughout a lifespan, people tend to generally gain weight as they age, and regular physical activity can help prevent that from happening. For all of the other outcomes, they were looking at physical activity irrespective of body weight, either starting weight and irrespective of if body weight changed. So obviously for things like diabetes, that losing weight at the same time and doing physical activity, both of these can have important pieces to benefit diabetes. But a lot of the overall health outcomes really were physical activity and X, irrespective of the body weight.
All right, when looking at the literature review and the science about behavior change initiatives, were there specific theories shown to be effective and which was the most effective?
So they were looking more at not specific, the committee was finding, and I would suggest that you go back to the advisory committee scientific report and read their chapter. They weren't studying the specific theories. In general, a number of different theories made sense and did work. What they tended to look at, what were the strategies? So the things that I highlighted in the presentation of what works for individuals, what works at the community level, but a number of these different strategies, depending on how they're employed, all seem to be successful.
All right, this is a question for Frances about the Move Your Way materials. Someone asks if they can add an organization logo to those materials.
Currently, they are not set up to add an organization's logo, but we do plan to add customizable materials in the near future to health.gov. So if you are able to add a logo to the file after you download it, you are welcome to, but we will have that customizable ability built in soon on several of the resources.
All right. This is for Katrina. How closely do these new recommendations align with other nations, particularly ones that have lower healthcare costs or lower chronic disease rates?
So we were one of the first in 2008 with the physical activity guidelines to put out the numbers, the 150 minutes and the 60 minutes for kids. Since then, several other countries have picked up and adopted the same recommendations, including the World Health Organization. So we're very much in line with other countries in terms of what goals they have for physical activity.
All right, we have a couple of minutes, probably one or two more questions. If there was one that we missed earlier in the feed that you need to repeat. Oh, they're talking about how to understand what is a weight-bearing exercise, particularly it looks like in youth or related to bone health and muscle health and that relationship.
Yes. So jumping rope was what was asked in the question, but yes, jumping rope is a weight-bearing exercise. Things like running is a weight-bearing exercise. That's why there is an emphasis on muscle strengthening for adults as well as bone strength activities for kids. So jumping rope, hopping, skipping, things like that. Anytime where you're having contact with the ground, that can help for overall bone health.
All right. There was a question. It looked like someone attended the conference earlier this week and got the flash drive, and there was a file that was mislabeled. So we'll make sure that that's all corrected on the website. When the slide deck will be available on the on health.gov. People are asking.
So as I mentioned earlier, we are working on a slide deck that you'll be able to use and download if you want to teach off of the guidelines. One of the things that takes us an extra few steps before we put materials up online is to make everything 508 compliant. So we are working on that piece, and we will have that information. If you like updates, we've mentioned a few times about other pieces that we're working on adding. Make sure you are signed up for our listserv on health.gov. So if you go to health.gov/PA guidelines, on the far left side of the screen and go to the bottom, there's a link to join. And so we send out updates through our listserv that way. We're not able to email you all individually when things come out. Appreciate the ask, but it's easiest for us to send a blast out to everybody to let you know when we've updated or changed things.
All right, I think we're gonna wrap it up. We appreciate some of the comments about things on the website. We'll look into those as soon as possible. And then I don't know if Jana or Dr. Pate want to say any final words.
Well, we'd just like to thank everyone very much for participating today. Thank you very much for your questions, and thank you so much to Katrina and Frances and Kate for providing this session today. And thank you so much for your support of the new physical activity guidelines. I certainly encourage everyone to actively support their dissemination and for supporting actions that will help a lot more Americans meet these new guidelines. So thank you all very much for joining today.